Vitamin A is undeniably vital for health, yet, like many essential nutrients, it requires a delicate balance between sufficiency and excess. When consumed in excessive amounts, particularly from high-dose supplements or certain medications, vitamin A can become toxic, leading to a condition known as hypervitaminosis A. This toxicity is a powerful reminder that even nutrients necessary for life can become harmful if not managed carefully, underscoring the importance of understanding dosage, sources, and individual needs. One of the primary dangers of vitamin A toxicity lies in its accumulation in the liver, the body's central organ for storing and regulating fat-soluble vitamins. Unlike water-soluble vitamins that are excreted quickly, excess vitamin A can build up in liver tissues over time. This accumulation can cause inflammation and damage, impairing liver function and potentially leading to serious complications like fibrosis or cirrhosis if unchecked. Individuals who consume large amounts of preformed vitamin A, commonly found in animal sources like liver or in concentrated supplements, are particularly at risk, especially when these intakes far exceed recommended daily allowances. The symptoms of hypervitaminosis A often begin subtly but can escalate quickly. Early warning signs include nausea, headaches, dizziness, and fatigue, which may be mistaken for other common illnesses. As toxicity progresses, more severe manifestations such as bone pain, joint stiffness, and swelling can develop. Vitamin A excess interferes with bone remodeling by stimulating osteoclast activity, which breaks down bone tissue, potentially increasing the risk of fractures and osteoporosis over time. This makes chronic vitamin A toxicity especially concerning for populations already vulnerable to bone loss, such as postmenopausal women and the elderly. One of the most critical considerations regarding vitamin A toxicity is its impact during pregnancy. Excessive vitamin A intake, particularly in the form of retinoids or high-dose supplements, has been linked to an increased risk of birth defects affecting the brain, heart, and face of the developing fetus. Because of this risk, pregnant women are advised to avoid megadoses of vitamin A and to consult healthcare providers before taking any supplements. Instead, a well-balanced diet rich in beta-carotene, containing fruits and vegetables is recommended, as the body regulates the conversion of beta-carotene to vitamin A according to its needs, minimizing the risk of toxicity. The potential for toxicity also highlights the difference between preformed vitamin A, retinol and retinol esters, and provitamin A carotenoids like beta-carotene. While preformed vitamin A can accumulate and cause harm in excess, beta-carotene is generally considered safe because the body converts it into vitamin A only as needed. This built-in regulatory mechanism makes beta-carotene a safer way to maintain adequate vitamin A status through diet, without the risk of overdosing. Certain populations are more susceptible to hypervitaminosis A, including those who use vitamin A-containing medications like isotretinoin, commonly prescribed for severe acne, or retinoid-based therapies for skin conditions. These treatments can deliver very high doses of vitamin A derivatives and require close medical supervision. In addition, individuals who consume large amounts of liver or animal-derived supplements, sometimes as part of alternative health regimens, should be cautious and aware of total vitamin A intake. Because vitamin A toxicity symptoms can overlap with other health issues, diagnosis sometimes requires careful assessment of dietary history, supplement use, and blood tests measuring retinol levels. Treatment generally involves stopping vitamin A intake and managing symptoms. In most cases, vitamin A levels return to normal over weeks or months, and symptoms gradually resolve, but severe toxicity can cause lasting damage, particularly to bones and the liver. The key takeaway from hypervitaminosis A is that more is not always better. The power of vitamin A to support vision, immunity, skin health, and growth depends on consuming it within safe limits. Public health guidelines and dietary recommendations exist precisely to balance its benefits against potential harms. For most people, obtaining vitamin A through a varied diet rich in colorful fruits and vegetables, moderate amounts of animal products, and careful use of supplements under medical guidance is the best approach. In a broader sense, vitamin A toxicity teaches a fundamental lesson about nutrition, that optimal health arises not just from consuming essential nutrients, but from respecting their complex interactions, safe thresholds, and individual variability. By embracing balance and awareness, We ensure that vitamin A remains a vital force for well-being, not a cause of harm, through every stage of life.